All right, everybody, it's Dr. Lisa L. Campbell back with part 4 of your week 5 lecture. We're in chapter 13, which focuses on the male genital section. You know the deal, all things male genital section. Let's dig in. We start off with different abbreviations that you should be familiar with. Again, I don't necessarily recommend writing these all in your manuals. Um, you'll be surprised. Sometimes they're already there and you just need to get to know your manual better. All right, so the male genital system, primary function is reproduction, but as you know, the male genital system is also part of the urinary system. We talked about the urethra. All right, so procedures are completed on the penis, testes, and epididymis, scrotum, vas deferens, prostate, tunica vaginalis, spermatic cord, and spermatic vessels. Beginning of chapter, what chapter is this? I think it's chapter 13. They define all these body parts. I just don't have it in me. And this is not an anatomy class. All right. So procedures that are um, completed on the penis. So the penis is an organ through which the urethra passes urine to be expelled from the body as a part of the urinary system. But as it relates to the reproductive system, the penis delivers spermatozoa to the female reproductive tract, and the distal end of the penis is known as the glans penis. All right, so codes that you see over here are for like circumcisions, incision, repair, and introduction. The testes is next. These are glands located in the scrotal sac that produce sperm, and they're also referred as testicles. I think that's probably the more common name that you hear. So the excision codes begin this subcategory. You see codes for biopsy, excision of lesion, exploring undescended testes are also found here. And there are some notes that are present in this particular area to reflect that other services may be performed at the same time and how you handle that. Orchiopexy. Pexy is fixation, right? So this is a surgical fixation of the testes in the scrotal sac. Laparoscopic repair of a hernia performed at the same time as an orchiopexy will be reported with 2 repair codes, one for the hernia, one for the orchiopexy. So there are some instructional notes that you want to pay close attention to. All right, epididymis and tunica vaginalis. So the epididymis is a tubular structure that is found at the posterior border of the testes and carries sperm to the ductus differentia, also known as the vas deferens. And the tunica vaginalis is the membranous sac within the scrotum that covers the sides and front of the testes and epididymis. This particular code family begins with incision and excision codes. There are some notes there that tell us if we have a fine needle aspiration biopsy, we got to go back up to the front of the surgery section. One of the things I will tell you is that the manual does a great job of sending us back and forward. The question is, are you reading the notes? All right, scrotum and the vas deferens. So for scrotum, you're going to see codes for incisions, excisions, and repairs. Vas deferens, incision, excision, introduction, and repairs. All right, so the scrotum encloses, protects, and supports the testicles. And the codes here are going to be things like for drainage, exploration, resection, and scrotoplasty. Then we have the vas deferens, also known as ductus deferens or seminal duct. These codes you're going to see things like vasectomy over here in this particular range of codes. Spermatic cord and the seminal vesicles. The spermatic cord is a covering around the nerves and vessels that encloses the seminal duct. Seminal vesicles is part of the ejaculatory duct. Something else about the seminal vesicles, the vas deferens come together to form the ejaculatory duct posterior to the urinary bladder. There are some services that are bundled into this particular area, so you want to pay attention to the notes. All right, prostate gland. The prostate gland secretes fluid that is part of the semen and aids in motility of the sperm, and it is located below the urinary bladder and on the upper end of the urethra. The prostate subcategory contains notes and notes that you will need to refer to. And over here, you have incision codes. There's a note that tells you, hey, if you use imaging guidance, you can report it if appropriate, unless the code says you can't. Then we also have needle aspiration and transurethral drainage codes. And then, of course, you have some laparoscopic procedures, and you know the deal. Diagnostic is always included in the surgical. Also, there are some notations regarding these particular codes in terms of if robotic assistance was performed. But then also there is a note right by this particular code that explain that coding for peritoneoscopy and an open procedure. So the notes are there. The question is, are you going to read them? All right. And then it wraps up with electro ejaculation procedures, cryosurgical ablation of the prostate, transperineal placement of needles or catheters into the prostate, placement of interstitial devices, placement of therapy guidance, and then the cryoablation of the prostate. All right, reproductive system procedures here. This is where you're going to, and actually there's only one code under reproductive. And this is code 55920, which reports placement of needles or catheters into pelvic organs and or genitalia for subsequent interstitial radio element application. There is a note here that provides guidance in reporting of the placement or needle catheters into the prostate. And you want to make sure that you review that. All right, then we have the last part, which is called intersex surgery. And this is the section that report the different procedures that a patient undergoes for sex change operations. All right, so all things male genital system. Last chapter coming up, which is chapter 14 on the female genital system.